Welcome back to my bathroom, everyone. As promised, I'm going to start going through over the next several days some specifics about all of these products that I highlighted yesterday. Yesterday we spoke about the GRASS acronym that we use in skincare. So as a reminder, that's G for growth factor, R for retinoid, A for antioxidant, S for sunscreen, and the other S for specialty products. But what do we all do before we start our skincare routine? We all wash our faces, or at least hopefully we are. So we're going to talk about face wash. My favorite product that I use every single day is Epion's Purifying Wash. As I shared yesterday, I am acne prone. Again, I joke with my patients that we go right from pimples to wrinkles, and I didn't have a break in between. So I've been treated for acne since my teenage years, and continue to need to do so, otherwise I get that random breakout. Been on Accutane twice. With any of you that have been on that, you know that's kind of like the holy grail for acne, and I've required 2 courses of it. But this particular product is great for acne-prone skin. As I said yesterday, Epion's is a skincare line that is all plant-based botanical extracts developed by a dermatologist out in the Midwest that has done a lot of studies on the medicinal benefits of plant extracts. I believe that everything was put on this earth for a reason, and when we learn to harness those powers, it really can benefit medicine. So Epion's, the Purifying Wash, contains spearmint, peppermint, and willow bark extracts. Willow bark is actually one of the natural sources of salicylic acid. You may see salicylic acid as an active ingredient in a lot of over-the-counter acne products, and willow bark is actually one of the natural sources of that. It's very purifying and clarifying. It really pulls out a lot of the impurities in our skin. It has a nice cooling effect on the skin as well. Comes in a very large bottle, so you can use this on your chest, your back, your face, anywhere that you get acne breakouts. I always tell my patients, if we're treating your acne, you need to treat your acne. So some patients only use their prescriptions on their face and they forget about their back and chest. So just a reminder, if you do have other areas that are prone to breakouts, please remember to include treating those areas as well. Dr. Thornburg also, he's the doctor that developed this line, did a study on spearmint tea. He looked at 2 cups of spearmint tea a day against an oral antibiotic that we prescribe called minocycline. I absolutely hate prescribing antibiotics unless I absolutely need to. Antibiotics disrupt the balance of bacteria in our guts for sometimes months at a time. So the bacteria is there for a reason, and I think we really are learning that we need to respect the balance in our gut. So I really only like to use oral antibiotics if I absolutely have to. So again, he did a study that he actually compared the 2 and found that spearmint tea was as effective as oral antibiotics, and I think it was a 6 or 8 week protocol. And what we found from that, and why he selected spearmint tea, was because we know that spearmint has both anti-inflammatory and antibacterial properties. So bacteria and inflammation are 2 of the 5 key mediators of acne. So he was very thoughtful in his formulation of this product, and one of the reasons that he selected spearmint as an active ingredient. If you do use a medicated wash, I only recommend it once a day. If you over dry your skin, it can actually irritate you, which means you may not tolerate some of your other products, and your skincare products that you're leaving on your skin are very important to use. So if you're not able to do that because your skin is too dried out from over cleansing, that's not ideal. So medicated washes only once a day, otherwise a non-medicated wash. All of these companies make great non-medicated washes. It's really patient preference. As long as you I like the smell, I like the formulation. There are gels, there are milky cleansers, there are foaming cleansers, there are creamy cleansers. So that really does come down to a patient preference. This one happens to smell lovely. Again, it has that minty smell to it. So again, once a day with the medicated wash, and then another time with a non-medicated wash. So for those of us that are wearing makeup, you better be washing it off in the evening. So for those patients, you really need to be washing your face twice a day. Not everyone does, not everyone necessarily needs to. Most of us would probably benefit from it. But again, Epion's Purifying Wash, one of my favorites. Thanks for joining me again in my bathroom, and tune in tomorrow where we will start getting into the nitty-gritty of our GRASS skincare routine. Thanks, bye!